Hello and welcome to Focus on Health. I'm Dean Leisgang. We're back after a year absence. Today we're at the Aurora Medical Center in Oshkosh talking about post-COVID syndrome with pulmonologist Dr. Bhadriraju. He provides some important insight today on this valuable topic. Okay, doctor, thank you so much for making time for us today. What exactly is post-COVID syndrome?
So post-COVID syndrome is a name that is being used for patients who had experienced COVID infection, who have persistent symptoms after they recover from the COVID.
And what are some of the long-term effects that we're seeing?
As you know, COVID has been around for a year, or just a little over a year for us now. And most of the time was spent in just taking care of the acute COVID symptoms. And now we're beginning to see a lot of patients come back for their clinic follow-up with symptoms which we now recognize as post-COVID symptoms or post-COVID syndrome. What we have to recognize here, though, is that the symptoms or the problems that the patients are experiencing post-COVID can be kind of thought of as related to the actual COVID infection itself, with persistent symptoms because of the damage to the organ systems, like the lung, for example. It can be exacerbation or worsening of underlying medical conditions. So, for example, somebody who has diabetes, obesity, heart disease, and they are stressed by this COVID infection, their underlying conditions can be worse or can make the recovery take longer. And the third thing is the COVID-related infection, residual effects of the infection or inflammation itself. This is something similar to what we call as chronic fatigue syndrome, and this can certainly be seen not just with COVID, but any other severe infections like viral infections.
And I guess the term long-haul symptoms, those are some of the things that you're referring to?
Yes, sir. So the long-haul symptoms is just a name given to patients who experienced a variety of symptoms from multiple systems. So, for example, they can come back to see us because they are having persistent shortness of breath related to the damage to the lungs. Some people complain of headaches. They complain of what is colloquially described as a brain fog, where they're they cannot concentrate, they feel fatigued all the time, just body aches, cannot sleep. And so a variety of different disturbances that the patients experience after recovering from COVID, we call it long-haul syndrome or post-COVID. And this can take a variable amount of time. I have patients in my own clinic that I have been following for several weeks to several months after they recover from COVID, and they still have oxygen requirements, they still have shortness of breath, they still have these headaches, and some of these symptoms you cannot pinpoint and say this particular reason is why you're experiencing these symptoms, so we call them as long-haul symptoms and provide the supportive care they need.
That's very interesting. I know a lot of people that have the things you're describing, and I'm sure a lot of people at home do as well. So who is most at risk for having a post-COVID syndrome?
That's a very interesting question. Tens and thousands of people, almost 30 million people have been affected by COVID, and we are seeing a lot of those patients who recovered come back with these symptoms. Now, while it is difficult to pinpoint and predict exactly who will experience these symptoms, older patients who already have coexisting conditions like diabetes, hypertension, heart disease, like I said, will take much longer to recover from the effects of COVID infection.
And where should someone go for help or assistance if they're experiencing some of the symptoms you've discussed?
Right. I would encourage them to reach out to their primary care physician. They can also reach out to the pulmonary clinic, because majority of these patients that we see in the hospital, we certainly follow them in the pulmonary clinic at the Aurora Hospital.
And then home care, is there anything they can do at home to help themselves?
Yes, we do have option for post-discharge home care, not only for COVID, for any serious diseases that the patients are hospitalized for. And the nurses who see the patients, when they recognize any serious symptoms, they certainly reach out either to encourage them to go to the emergency room or reach out to their physicians.
We've certainly talked a lot about symptoms, so if people are at home, what can they do to alleviate or lessen some of the symptoms you've discussed?
The most important thing is to have awareness so that there is no fear. The fear of the unknown is the worst thing that can happen to a person. So if you're aware that this is a possibility, then you will approach it differently. Symptomatic treatment, treatment for your headaches and fevers, you can certainly do with Tylenol in a limited quantity. If lung problem, because long-haul syndrome or post-COVID syndrome can affect one or more organ systems. So some people are perfectly breathing, but they have other problems like headaches. So if lung problem persists, or if you have what we call as ARDS, which is like a diffuse lung injury due to COVID, and those pneumonia-like chest X-ray findings persist for weeks to months. In that case, you can continue to do what we call as self-proning, which is basically sleeping on your stomach, at least at nighttime, but as much as possible during the daytime. And what that does is it redistributes the relationship between the blood flow and the air you breathe and helps you send more oxygen into the bloodstream. So try to do that as much as possible. Have a positive attitude. You don't have to stop anything and sit at home. You can be as active as your body allows you to be. But if they don't ever hesitate to seek medical attention.
And just a follow-up to that, what about mental health?
That's actually a very good question, because the effect of COVID infection on mental health may be the least recognizable by the patients, and there's also maybe some stigma attached to it. So it's very important to be cognizant that some of the physical manifestations may actually reflect underlying depression, especially for patients who are prone to depression by either family history or pre-existing depression. So they react to depression, to the illness, loss of livelihood, the fact of being in a hospital. All these factors play a role. So do not hesitate to reach out again to your primary care physician or your mental health professional. It is a medical condition. It's not a fault of yours. So definitely reach out, especially if there are suicidal thoughts. Reach out to the helpline and get the help you need. I would also encourage faith. If you're a person of faith, reach out to your church, your place of worship, and friends and family support. All of them play a role in addition to just medications.
Very good information. I appreciate you touching on that. That covers all my bullet points. Did you have any final thoughts you wanted to put out there?
No, thank you very much. Again, like I said, prevention, prevention, prevention.
Outstanding. Thank you so much for the valuable information and also for your time today.
Thank you. Appreciate the opportunity.
If you still have some questions about post-COVID syndrome or would like more information on the topic, feel free to reach out to Dr. Bhadriraju's office or your primary doctor. And of course, you can always call Aurora at 920-303-8700. And there is also a wealth of information at aurora.org. Thank you so much for joining us today. I'm Dean Leisgang. We'll see you next time on Focus on Health.